Good morning. Well, this week has been full of activity, and I can tell you that next week will be too, because usually when I finalize this presentation on Thursday afternoon, a whole bunch more stuff happens between then and Friday morning. But we're going to cover this week, and there's been a lot of activity that's been very specific to disability. We're going to start a little bit unusually with a press conference that happened at the national level that has really had a lot of impact on Wisconsin and reaction in Wisconsin this week. So Monday afternoon, the White House and the Department of Health and Human Services, the Food and Drug Administration, the Centers for Medicaid Services had a combined press conference to announce a new report that they are releasing on autism. And you may remember in May, the Secretary of Health and Human Services, Secretary Kennedy, had made an announcement and said, "Hey, we're going to have this report in September that's going to, come out with the causes of autism." We all may also remember that Secretary Kennedy and others had made some previous comments about people with autism prior to that really set up some metrics about, here's a population and then listed a number of things that they felt like people with autism would not be able to do. So this particular press conference is coming out of, several statements and also, telegraphing that this report is coming for some months. In the previous couple of weeks, we have talked about some coverage of what was likely to be in that report. You may remember that a couple weeks ago, the press was telegraphing that this report might claim and state that there were some links to a common drug, acetaminophen, and other and vaccines that they were anticipating would be part of what this report is. So the press conference on Monday, and you have a link to the actual press conference. It's a little over an hour long, so I encourage people to go and listen directly to what was said at the conference. Happened Monday, and I think one of the takeaways was that again, autism was described as an epidemic, as a crisis, and really used a lot of language that we associate with disease. And various folks from the administration really portrayed this as a horrible crisis. There were several times when people said people with autism are difficult to look at, and lots of language that is consistent with some of the earlier comments that we heard this spring. And it turned out that the earlier reporting on what this report was going to contain was accurate. The press conference clearly stated that they were tying acetaminophen, and they used the brand name of Tylenol to talk about acetaminophen. Acetaminophen is the name of the drug itself, and it is in many products, including Tylenol is a brand name of it. That acetaminophen use during pregnancy, low folate levels, and vaccines were causal to autism. The secretary also said that the FDA would be issuing a physician's notice about acetaminophen use during pregnancy, and that there would be a public service campaign warning against acetaminophen use. So that's a pretty significant policy change. It's important to know that acetaminophen is the most widely used drug in pregnancy because it is the most studied, and because it is a drug that is used to reduce fever. And fevers are a sign of infection and the body's response. And fevers are are associated with, developmental disabilities and in children, that if the mother is having a high fever, that is a potential risk to the pregnancy and the developing baby. So acetaminophen is an over-the-counter pain reliever, and if there is one drug that it is likely pregnant women may have taken, it is probably that one, because some of the other drugs that are used to reduce fevers, like ibuprofen and aspirin, actually are not recommended for use in pregnancy. Um, they also announced as part of this press conference that they would be approving a drug called leucovorin as a prescription treatment for autism. Leucovorin is a form of folic acid, an essential B vitamin. It is approved for other uses already, and we'll talk about what some of those uses are. So um, there are some very small studies that show for some people with autism, this may be therapeutically useful, but there are no large studies that show that this particular drug is useful in general to people with autism. And we'll go into that a little bit further because we have a Wisconsin-based autism researcher who is actually pretty clear about this. The important thing to know here is that many of the claims that were in this press conference go against what mainstream scientists overwhelmingly agree upon. Um, and the coverage that has come out since the press conference has been pretty consistent about saying autism is the result of many things, and it's not a simple cause and effect. There are lots of different genes that are associated with autism. There likely are environmental factors. Genes and environment can combine to produce, to potentially be causal to autism. And there's also a lot of discussion about one of the reasons we're seeing greater increases in the number of people who are diagnosed with autism is because we are screening far more people and we have expanded who we count and put into that category of potentially being within the autism spectrum disorder category. So there's a lot more people being tested and a lot more people who, when they are tested, fall into this kind of big definitional category. And scientists have been pretty clear about that's one of the reasons why you see an increasing rate. There's also been a lot of extensive research, looking at the connection between vaccinations and autism and not finding a causal link. So this press conference is really saying some things that the science does not necessarily support. And in some cases, the science is saying, no, this isn't, that we're pretty clear that there isn't a clear link here, or it is not a simple relationship. We put out a statement. You can access it online. Here is the full statement here. And I just want to take a moment to kind of talk about why we've constructed it this way. I think it's important to recognize that autism is a spectrum, and there certainly are people with very significant needs and people who are absolutely successful in all of the metrics that able-bodied people define for success. There's a broad, array of needs and abilities on the spectrum. And one of the things that we saw when Secretary Kennedy made his comments in the spring, he kind of had a long list of things that he stated autistic people will never do. And I think there was a somewhat natural reaction from parents who have autistic family members who could actually do all those things to say, no, that doesn't fit me. My person can do these things. And that isn't really helpful because, there are people with autism who may have different abilities, and they may be able to do some things or not others, or they may not be able to do some things. And that's the point. You shouldn't have to prove against able-bodied metrics that you are worthy of support or that you are valuable. And we want to recognize in our statements that, every person with autism has value, and it isn't about, how much people participate or the amount of help they need. That doesn't take away from their value or make them less deserving of support. And, it is also very true that there are people with autism who aren't getting the support they need in the system that we have now. And that is more true for people who have significant needs. And there are really families who are struggling within those systems, which sometimes feel like they're kind of designed to provide the least amount of support possible and really rely on families to make up the difference. So I think that it's important in these moments to really circle around and get at the most basic of messages, which is that all people with disabilities have value and deserve the support is that they need, and that they don't have to prove themselves worthy of that support, or prove themselves disabled enough to get it. Those are the kinds of things that divide a community and take away, from the real problems of we have families who are really struggling and need more support than they're getting. I also think it's important that there isn't a blame, like there's the idea of blaming a certain thing or a certain action as a cause for a disability is extremely destructive. Because again, blame means that there's somebody who did something wrong and that is the cause. And we have a lot of times in used blame to define who is worthy of support or worthy of help. And I think that it's really important to make sure that, autism is a natural thing that has always existed, and it impacts people in different ways. And there isn't one source of the one reason that you can identify why autism occurs. Um, and I think that we're trying to recognize that, there is a lot of need out there that's being unmet, and that the kind of statements that we heard on Monday really aren't helping address those things that families are most struggling with now. Many advocates across Wisconsin reacted this week. This is a small sampling of the stories that were run. And, hats off to all of the advocates and family members and people with autism who reached out to reporters and started talking about this. There were a number of really good stories that were reflecting that family perspective and just saying, some of some of what has been said is just not helpful to the realities that we are dealing with now. I'm going to focus a little bit on this Wisconsin-based researcher who had an interview on Wisconsin Public Radio. And, she went through the kind of the science with regard to Tylenol and leucovorin in I think a helpful way. I don't know if this happened to you, but I noticed, as soon as these statements came out on Monday from the administration, there was a lot of heightened traffic on social media with all sorts of questions and confusion and understandably so, about what does this mean and what are these studies that were being referenced. There are a few small studies. There's lots of studies on acetaminophen in pregnancy. There's a reason it's the only drug that's really doctors have been recommending for many decades to treat fevers during pregnancy. And so some of what the president was saying was actively telling pregnant women not to take this drug while they were pregnant. And this researcher said, well, actually the presence of a fever is a risk factor in itself. So, and there are other painkillers or, products to reduce inflammation that actually are known to be harmful during pregnancy. So it's again another reminder of, there's a long-standing recommendation of what drugs to take and not take. And acetaminophen is amongst the most studied. So again, people who are pregnant or have been pregnant, there's a large body of research that says taking Tylenol at the recommended dosage and working with your doctor is okay. And the advice is to keep consulting with your doctor. Leucovorin, again, this was the product that was suggested to be a treatment for autism, is a approved drug for other things. It's primarily used as a drug to lessen the impacts of chemotherapy side effects at the moment. But I thought she was really good about saying, like, okay, there are subgroups of people with autism who have a certain kind of folate deficiency called cerebral folate deficiency. And she was really clear that this is actually a hard thing to measure and test for. It's not easy. Like, it might involve a spinal tap. This is, you can get diagnosed to see if this is an issue for an individual with autism. It certainly is not a deficiency for all people with autism. But for some people with autism, it is. And it is something that requires some intensive diagnostic testing to see if it is present or not. And she was clear saying there is a study that shows that for some people with autism who already have cerebral folate deficiency, this could be a treatment. The studies that exist on leucovorin only look at people who have cerebral folate deficiency. So they've gotten the testing, they know that they have it, and when they supplement it with this drug, it does appear to improve symptoms for some people, not all, but some. And so there is this very small study that for some people with autism who have this deficiency, this may be helpful, but that is not the same as this is a drug or a treatment for all people with autism who do not necessarily have this particular deficiency. So I think that's just a really important message, because we were starting to see some traffic of people scrambling to try and get their doctor to prescribe this treatment. And I think that's one of the dangers when people hear that this is, there's a cause or effect, they start to change their behavior. But, if your person with autism doesn't have this particular deficiency, and you've been told that this may be something that will improve symptoms, and then it doesn't because you're not addressing a deficiency that the person has, I think that can be really, really damaging to folks as they are, looking for something easy to do that might result in a change, and that change doesn't happen. A couple of national articles just to emphasize. This one is this is actually a gift article for those of you who are not subscribers to this paid publication, but I thought this was pretty thorough about how, our understanding of autism and who we include in within the definition of autism has changed over time. It also addresses some of the other comments that were made during the press conference. There were some comments that certain populations of people or certain places in the world don't have autism, and there was an assertion made that those places don't have acetaminophen or don't use vaccines and they don't have autism. That is not true. Autism exists everywhere in the world. Um, whether or not people are tested for it, or, in some places they don't call acetaminophen by the same name. Definitely there are places that have more or less access to vaccines, but autism exists everywhere. Culturally, whether people are accepted or stigmatized, that varies based on culture. So I think that there's some important information here if you're looking for a good, solid, understanding of, you know, the history of autism and how we understand it in the world. This is a pretty good place to go. I'm not going to go through all of these articles, but there's been a tremendous volume of articles from the scientific lens that are really refuting the claims that link acetaminophen use during pregnancy to autism, and the usefulness of this drug to autism, and also the connection, the studies that do not find a connection to vaccines and autism. So there's been a lot of coverage, kind of talking about the gaps in science, and the scientific community is not saying that what we heard on Monday is true. They are saying the autism, or the opposite of that. And as the week has gone on, we've also seen more people at the national level with autism that are talking about this issue from the lens that many people in Wisconsin have, which is saying, hey, we do think it's important to research causes and other things, but to devote all of this attention and time to thinking about autism as a thing to prevent really ignores the reality that autism has always been with us and always will be, and it ignores the reality of what autistic people and families need right now. Um, and there have been a number of pretty big pieces that are now coming out in the later part of the week that are much more aligned with what Wisconsin advocates were saying on Monday. So I think it is important, now that we've kind of had 3 or 4 days where post this press conference, and of course there's always much more things that are happening. It is important to really connect with lawmakers and talk about like the damage that you know that kind of press conference can have on real people. There's, I have a list here of things that I have kind of seen from people around the state, either on social media or in conversations, people asking themselves, did I take this drug? You know, or other well-meaning people saying, hey, could you try these things? It is perfectly fine to feel whatever you have felt during the week, and just know that these are things that we have heard probably from multiple people across the week as a reaction to this press event. I think it's really helpful for lawmakers to understand what it means when the president and administrative agencies are making not only statements about autism that aren't rooted in science necessarily, but also making policy decisions and decisions about where to put research and funding that aren't necessarily addressing what people feel like they need now. I think it's also time to really remind folks that these aren't just words. This is a consistent theme that we have heard over months, and it is concerning that there's a real communication that is devaluing, people with disabilities. And I think that It is really important for lawmakers to hear from people with disabilities and their family members that you are noticing something and that it does have a real impact on your life. Survival Coalition held its press conference very much in the same vein. Um, you know, totally focused on the kind of ongoing rhetoric and that we've been hearing over many months and what that impact is on people with disabilities. Um, it was broader than just the autism press conference that we heard on Monday, because I think there have been kind of a constant drip of different, changes, either, budget cuts or research funding changes or, items included in HR1 that all impact people with disabilities more than some other groups because we rely on those programs more. But certainly the release of the autism report this week kind of was a exclamation point on some of the statements Survival was making. And we did include a person, a family member who has um, I believe a son with significant needs, including autism, on that panel. So you can look at that recording at your leisure. It's about an hour long again on YouTube, and feel free to share it. Moving into the Affordable Care Act marketplace, I tell you, this was just a really great panel. If you want to look if you've been looking for dynamic coverage of the ACA marketplace by some very excitable insurance professionals, this is the video for you. It was really good, and really went into detail about, what does it mean if Congress doesn't extend those ACA marketplace subsidies, but also what are all the changes that are going to happen anyway, that were either included as part of HR1? How will those impact the Wisconsin marketplace? So it's worth a listen, especially since there are a lot of things that could happen within the next month. Whether and when the ACA subsidies are extended does impact, what people will be notified for and the decisions they're going to make in November. And certainly if they extend them after that open enrollment period, that leads to a whole nother set of questions and adjustments for the state. And it's also important to remember that there are a bunch of changes that have nothing to do with the subsidies that are going to make some pretty significant changes in the marketplace for Wisconsin, including a 90% cut to the federal funding that was helping covering Wisconsin, the group that is responsible for kind of helping people navigate the system. So lots of stuff to discuss there. You may have also heard this week that there are a couple of insurers that are deciding whether or not to offer marketplace plans. There is Common Ground Healthcare Cooperative is not going to be offering plans in 11 Wisconsin counties, partially because they are operating under the assumption that those ACA subsidies will not be extended. And so there's 24,000 people in 11 counties that are going to need to find a different insurer as of next year because their plan they have now will not be offered in 2026. A lot of coverage about, whether those expirations of subsidies are a factor in what plans are offering next year, and a lot of concern and projection that without those subsidies being extended, there will be healthy people who are lower cost and help pay money in to cover higher cost people would choose to go uninsured, which would mean that there are essentially more healthcare users who are higher cost users left, and not a lot of other people to offset them. So part of what, insurers are trying to calculate is, if we don't have the subsidies, how many people do we think will not join those plans? And generally, we see a relationship between more generous subsidies helping people pay for plans, meaning that there's more competition in the markets. And when those subsidies go away, there are fewer plan options because of that. So this is kind of a known relationship. There could be some other insurers that are going to exit the marketplace entirely. So Chorus Community Health Plans is also not going to be participating in the ACA marketplace next year, and that affects about 11,000 people in 15 counties. So that's two insurers who are either totally not providing any plan offerings next year or reducing the amount of plans they have in certain counties as of this moment because of the uncertainty at the federal level. So just a little quick, we are here. You'll notice that we are moving much closer. For those of you keeping track at home, September 30th is next Tuesday, and that is the last day of the federal fiscal year and the deadline for Congress to do something in order to avoid a government shutdown on October 1st, which is next Wednesday. There is now only one path to avoid a government shutdown. Last Friday, the U.S. House passed the Republican version of a continuing resolution on a party line vote. And that essentially was an extension of the current funding plan through November 21st with extra money for security for people in Congress and administrative officials and the judiciary. So it was they call that a clean CR, except it wasn't totally clean because they added some money that they weren't spending elsewhere. But essentially keep things the same until November 21st in order to buy more time to negotiate. That's what the House passed. The U.S. Senate held a vote on both the Republican version and the Democratic version of the continuing resolution. And you may remember that the Democratic version asked for some guardrails to make sure money got spent the way Congress allocated, plus wanted to include a permanent extension on the ACA marketplace subsidies and undo some of the cuts to Medicaid that HR 1 imposed, and some other items as well. Neither the Republicans' continuing resolution or the Democratic version had enough votes to pass. Remember, in the Senate, they need 60 votes to pass something. So we now have had a vote that has shown that neither proposal had enough support to clear those 60 votes. The U.S. Senate is going to be back late next Monday on the 29th. The House is not coming back until after October 1st. And what that means is that essentially the only option to keep the government open now is to approve the continuing resolution the House already said yes to, because the House isn't going to be in session until after the government funding deadline has passed. That means that if the Senate wanted to pass a bill that was different, the House couldn't agree to it. So really that is the only way to keep the government open now, is if the Senate passes what the House has already passed. And if they don't, then the government will shut down. We've covered a lot about what a shutdown generally means last week, but it is worth noting that a shutdown does give the administration more power over federal spending. And we're backing up a little bit here. Normally, when Congress passes a budget using their normal process, and that's that process where they're passing 12 separate spending bills that cover different agencies. You might remember the Labor, Health and Human Services, and Education budget has a lot of stuff in it that is important to people with disabilities. That's just one of 12 bills. There are detailed reports that are included with those bills that show how much money should go to which program. If you were here with us in August, we got a little excited because the US Senate did have a very detailed report as part of the committee's budget that they passed for the Labor, HHS, and Education Committee that did say, hey, we're noting we want you to spend money in this report on disability programs. And the House subcommittee also said the same thing. Well, those reports are part of the normal appropriations process and generally carry a lot of weight if you have a federal bill that passes. If when Congress passes its budget bill, those reports really do or have in the past dictated how money has been spent. But that isn't how we're operating right now. Under a continuing resolution, the administration has more flexibility to decide how to spend federal money than it does if Congress passes a budget through its normal appropriations process. And you might remember that we have been operating under a continuing resolution actually for more than a year. The last continuing resolution that we passed was in March. That has gotten us to this point, and we're talking about another continuing resolution. That is not the same as our normal budget process. It's usually supposed to be continue funding the government until we work out our differences on the normal process. And we have unfortunately had a pattern with Congress where they haven't been good about passing a budget through the appropriations process and have kind of used continuing resolutions. In the past, the continuing resolutions have spent money as Congress has designed, but that hasn't been true in this current administration. Long-term continuing resolutions often drop the detailed reports, and so the administration can look at that pot of funding in each agency and direct it as it wishes. So the current administration has, been operating under a continuing resolution, and it has been moving money out of programs that had previously been designated by Congress into other areas. So prior to this, a continuing resolution has meant kind of autopilot, do as we have always done before. That has been a shift in this administration. And some people are worried that if the full appropriations process never occurs, that kind of enables the same behavior we have seen up to now. Now, if Congress passes a budget bill through its normal appropriation process, that authority, that flexibility that the administration has over how to direct money ends. But some Republicans say Congress shouldn't pass a CR that doesn't expire until next fall. In other words, let's pass a continuing resolution that doesn't have an end date until like November or October of 2026. That would maintain the flexibility that the administration has and has been using in a way that is a departure from previous administrations. If the government shuts down, which is now next week, Tuesday, is that deadline, the administration has even more authority to make decisions over federal spending. And late Wednesday night, the Office of Management and Budget Director has in fact sent out a memo with instructions to agencies about what to do if there's a government shutdown that does look like they are thinking about this government shutdown in a very different way than government shutdowns in the past. We've had the government shutdown. Usually it's not for a long period. I think the longest was maybe 30 days in think 2018, 2019. But generally, there has been a pattern, and we covered it last week, of certain programs continue being funded as if nothing has happened. And generally, that has included Social Security, Medicare, Medicaid, things that are part of the mandatory spending line items that the federal government has. We've continued to pay our debt service, for example, for the country, the military, those kinds of things. And then generally, what has happened is the Office of Management and Budget has made, decisions about different discretionary pots of money, basically all the things that are people with disabilities, the Department of Education, Health and Human Services, a lot of different programs that are impactful to people with disabilities are in that so-called discretionary pot. And the administration has typically said, okay, we're going to decide who are non-essential workers, and those people don't come to work and don't get paid while there's a shutdown going on, and who are essential workers who have to come into work anyway but still don't get paid because there isn't any federal money coming in. And then generally, once the government has opened up, those people come back to work and they get back pay, and that has been how the process has happened. This time, the Office of Management and Budget's memo, and it is here in this link if you want to read it, and there's a couple pieces of coverage as well. This time, they're saying, well, if the government shuts down, it will start permanently eliminating federal jobs that it feels are not consistent with the president's priorities. And it's going to require agencies to keep only the smallest number of employees necessary to legally operate. In other words, the OMB is saying, if you're stopping federal money, we're going to make a decision about permanently firing people and only bringing back the smallest number that we have to after the shutdown ends. There is one article that listed the programs that will continue because of a shutdown, and I have copied exactly what they are from the article here. You'll notice Social Security and Medicare are listed here. Generally, Medicaid would be listed in this list too, and it isn't present here. I don't know what to make of that, except that, it could be an omission or it could be something else. It's hard to know, I guess is what my feeling is. But there are definitely programs that are being there that will not be impacted, that are being publicly listed. Some of them are really important to people with disabilities, and there's some programs on here that are important to people with disabilities that aren't on the list. Whether or not any disruption happens is, I guess we find out after next Tuesday. But there's a question you can ask Congress, which is, if there is a government shutdown, how are you going to guarantee that workers and funding for disability programs aren't going to be cut? Lots of commentary out there about will or won't there be a shutdown, and various, three-dimensional and four-dimensional chess structures out there about who wins or loses or whatever. You can follow all of those things. I think it's best to boil it down for our purposes to, is there going to be a shutdown, yes or no? And what happens if there is? And what happens, if there is a shutdown, are there going to be disability programs that are perhaps going to be permanently impacted because Office of Management and Budget is telegraphing that they are going to do something different than has been done before? The other big thing Congress has to do this fall, or not, it is really related to those ACA subsidies. Again, the extra money people get that helps keep their ACA marketplace premiums low is due to expire as of December 31st, 2025, unless Congress passes a law to continue them. It's not the only thing that's going to impact the ACA marketplace. There were many other changes in HR 1 as well as some administrative rule changes that are under litigation that will impact the marketplace. But most of the attention has gone to this rather large sum of money that the federal government will take out of the system and will be made up by the buyers of those plans, the consumers. It is not clear whether there's enough support to continue the marketplace subsidies before they expire. There is interest on both sides of the aisle, talking about how do we continue the subsidies, but not universal interest. There is a bill that's been introduced to extend the subsidies 1 year, that would set a new expiration date for when those subsidies expire, until next year, until after the midterm elections. It doesn't look like that proposal has enough support to pass. There's a different idea that the Democrats would like to permanently extend the subsidies. That idea also does not look like it has the support to pass. There are members of Congress who do not want to extend the marketplace subsidies at all. And there are other members of Congress who want changes to who can get the subsidies. What's being talked about publicly is like making an income cap, and if you're above a certain income, you don't get a subsidy. Or maybe the people who are currently in ACA marketplace plans continue with their subsidies, but no one who is coming into the marketplace can get one. Those are two ideas that were floated this week. There's also an idea of making some people who have ACA marketplace plans pay a minimum amount out of pocket before they get a subsidy. So there's a lot of very different ideas about, even if you pass a subsidy extension, it may not look exactly like what we have now. This week, there's also some special interest groups that want to kind of, whenever you get a crisis point where something has to happen or else something else happens, there's a little bit of leverage and kind of, we call it a vehicle. Folks want to try and get their policy priorities included on that thing that has to pass, because then you kind of get carried along and your interests get carried along with it. But these special interest groups have policy priorities that might mean if they were included, there would be members who would not want to vote for the bill. So we call that a poison pill, where you deliberately have items in a bill that will make it impossible for members of the other party to vote for. And that sometimes is a strategy used to essentially kill a piece of legislation, right? You create a piece of legislation that does some things that people want, but also does things people really don't want. And if there are enough things that people really don't want and not enough of what they do, then it becomes a bill that they can't vote for. So all of this stuff is kind of in the mix as we approach, that deadline. And one of the things that the Wisconsin Health News ACA Marketplace panel that we gave you a link to earlier shows is that really the deadline for when the ACA subsidies expire is technically December 31st, but Congress really has October to make some substantive decisions in order to avoid the start of impacts of those subsidies. The uncertainty that insurers are dealing with now and the uncertainty that plan holders will have starts to really influence their decision making now and especially in November. In November, many policyholders are going to be notified about how much their premiums for their current plan will increase in 2026. And some insurers are trying to think about how do we show them what it would be if the subsidies continue and what it would be if the subsidies don't. But now that we have Congress talking about not continuing the subsidies exactly in the same form, that adds more confusion to the mix about what those calculations would be. So if Congress really doesn't pass anything in October, that makes it a lot more complex for the open enrollment period in November because insurers and plan holders are going to be operating in a state of unknowns. Um, and they have to make decisions based on those unknowns. So, you know, if you are making a decision in November about what plan to continue with, and nobody has done anything on the subsidies, you might choose a different plan. You might choose a plan that has more out-of-pocket costs in exchange for lower premiums or less coverage for lower premiums. You may decide you go uninsured. There's lots of ways consumers have to the amount of money that they have determines what decisions they're making when it comes to healthcare coverage in the context of all of their other bills. And I think that, that's going to really be a challenge if Congress doesn't act before November 1st. The panel did a good job of outlaying, kind of the if-then situations. What if Congress passes something in November? What does that mean? Some of the moving parts that would be needed if the subsidies get extended, but get extended in a different time frame than before November 1st. But again, those are all things that just add to the uncertainty and to the layers of work, not only for insurers, but plan holders as they scramble to figure out what's the best deal that they can offer or that they can get for coverage. So another question that you can ask Congress, the impacts of not extending the subsidies are happening now. We already have a couple of plans who are in Wisconsin where they're either pulling out of the market entirely or offering fewer plans in fewer places. We already know that there are 25,000 plus 11,000 policyholders who have a current plan that will not be offered next year. So that's already impacting a significant number of people in the ACA marketplace. And we know that people are going to have to start making actual decisions in November. So some questions for Congress are you going to extend the subsidies? Because the answer could be yes or it could be no. And are you going to act on a bill in October? And I think those are very relevant for this moment, and we will probably have additional questions as the month goes on, trying to figure out what Congress will do, if anything at all. I'm not going to go through these slides except to say these are our standard slides of what are the big implementation deadlines of HR1. There is something important starting to happen again next week. September 30th is also the date where it's expected USDA is going to release the guidance to states on how to implement the new prove you're working or exempt requirements for the food assistance program, SNAP, food share in Wisconsin. And you might remember that guidance is really important because the HR1 actually set the implementation deadline for those changes as the date of the bill was enacted, which was July 4th in the past. So now we're starting to kind of move into the implementation phase of the first of the big cuts that are coming from HR1. Also next week, HR1 changes the error threshold for SNAP, which, as you might remember, the number of errors a state has determines whether they have to pay a large a part of state money to be able to draw down federal dollars for SNAP in the coming years. So those two things are starting to happen next week. Some folks have been asking for some time, as the Office of Management and Budget has been, freezing or impounding certain sets of funds, there hasn't been a clear picture of how much money has been, held back and where that money has been held from. So this is a new report for the Center on Budget and Policy Priorities, and it shows that, based on previous spending levels, that the administration has spent $26 billion less than what they should have spent before this time. So it does appear that there are certain, like, this reduction in spending is not evenly distributed. In other words, there are certain programs and agencies, often in areas that the president proposed be deeply cut or eliminated in his May budget proposal, that's where the most of the 2025 money Congress allocated hasn't been spent. The report is pretty clear about this is probably not a full accounting of the money that has been appropriated by Congress but not flowed out the door. There is a different estimate that the House and Senate Budget Committee staff have estimated that the administration may have frozen or canceled, and we've talked about some existing grants that have been canceled relatively recently in the education sphere in Wisconsin, or have said, no, we don't want to spend this money, and there are pending court cases. And when you look at that combined amount, it goes up to $410 billion that Congress should have already spent as of this September. Going back to the press conference where the administrator for the Food and Drug Administration said that they would be making some changes to an existing approved drug called leucovorin for autism treatment. I want to just hover here and say that the Food and Drug Administration has a really important role and process in approving drugs for use. And that process can take many, many years, and it often requires a lot of studies to be done. The reason for that is because when you approve a drug, you want to make sure that it works for the purpose intended, and make sure that it is safe for a wide population of people who might be taking it, and that it works for the specific purpose, and that you understand what dosages of the drug are appropriate to achieve the treatment you're looking for without any harmful side effects. So there are lots of drugs that are approved for a specific purpose, and sometimes there are additional purposes that they discover later those drugs are useful for. And sometimes you can get prescribed a drug for they call it an off-brand, or an off use. It's a secondary use. So that in itself is not unusual, that you have a approved drug that was approved for a specific purpose, and then later there are other things that drug is discovered are helpful with to treat. What is unusual here is that this particular drug is currently approved to treat side effects of chemotherapy, as a package of treatments with other drugs for certain cancers and megaloblastic anemia. It is not a drug that has been really studied in a lot, to determine whether this is an appropriate treatment for autism, and to what folks does it have the greatest benefit for use. There are studies, as our Wisconsin researcher has said, that there are some people who have a certain deficiency where this drug may be useful for that subgroup. But there haven't been larger studies that show whether this drug is effective for the overall population of people with autism, or what groups of people are more likely to benefit, and what dose is safe and effective. So it is an unusual step to relabel, to essentially say this drug is a treatment for this thing, without having done all of those studies and work. And I'll leave it at that. The other thing that has been brought to light this week, there have been lots of research that has been canceled over the last few months, especially at the National Institutes of Health. Some of that research has been about autism, and some of it has been specifically looking into environmental exposures that impact autism. So I think it's noteworthy to know that many of the government's best researchers on this topic who are looking for, connections beyond genetics to what could be causal to autism, and they have been doing so for several decades, that some of those longstanding, top people and research projects are no longer running. And we have been following that the Department of Health and Human Services is, making some adjustments and investing in very different research for autism. We've covered that over the past few weeks. So I think it's just noteworthy that at the same time we're having a press conference that's making statements about the causes of autism, we are also having the same administration canceling existing research that seems to be in alignment with some of the things that they are looking for in at least in terms of external environmental factors. There's been a lot of confusion last week from a meeting from the Advisory Committee on Immunization Practices. We covered this last week, and when we were presenting last Friday, it was actually the second day of their two-day meeting. If you're confused, you are not the only one. On Thursday last week, the Advisory Committee voted to remove its recommendation that children under 4 get the combined measles, mumps, rubella, varicella vaccine. And originally they said, but we're going to keep including that combined vaccine in the Vaccines for Children's program. That's important because the recommendations for the Vaccines for Children program really govern what all states have to provide to kids that are uninsured and children who are on Medicaid and some children in the Children's Health Insurance Program. So, what's recommended and on the list for the Vaccines for Children's program is absolutely something states have to provide free to people in those programs. But on the second day of the meeting on Friday, they reversed that decision. So they once again voted to remove the MMR vaccine, this time from being recommended on the Vaccines for Children program. And there was an article we covered last week that says that's really uncharted territory for states because it's unclear whether or not states have to continue to provide vaccines that they had been providing before if they're no longer on the Vaccines for Children list. It's also unclear about whether states can decide to provide vaccines that are not on that list with those public dollars. So we're in uncharted territory, and the article we shared last week was pretty clear about this is a new thing because we've never had the vaccine recommendations really be significantly changed or removed from this list. The committee also postponed a vote on delaying the hepatitis B vaccine, which is typically universally now given for newborns. To prevent hepatitis B, which causes liver cancer and cirrhosis of the liver in very young people often. And it's unclear whether that decision will be revisited, but we have seen a pattern on other issues in this administration, where in one moment in time they will delay a decision, and then at some future moment they will come back and make the decision that people anticipated they would have made at that earlier point of time. So it's unclear what the decision will be on Hep B, but the discussion at this last meeting was to remove that from the vaccine schedule entirely. And certainly the president's comments on vaccines during his Monday press statement with the department did have a lot of comments about the vaccine schedule and the need for changing the vaccine schedule and perhaps offering fewer vaccines or later dates. So I think this is an ongoing story that we will continue to follow. All of that activity last week at that special advisory committee has meant that there are a lot of states that are really starting to think about whether they need to establish their own vaccination protocols. So the panel making a set of confusing decisions last week, that has mattered a lot because insurers and federal programs have been relying on that committee's recommendations for their work. What to do, what not to do. Now, they're not binding, those recommendations. States can choose to follow them or not. And there are a couple of blocks of states in the country that are trying to create multi-state coalitions and come up with their own vaccine recommendations. There are also some states that are moving the other direction to eliminate vaccination requirements altogether. So you're starting to see a very different approach depending on where you live to vaccines. And it's worth noting that before we had there's a reason it used to be that every state had different ideas and different recommendations. And the reason that we moved to more of a universal recommendation, partially at the behest of states, is that having very different requirements based on geography actually didn't turn out to be helpful from a public health standpoint in preventing disease, because diseases don't really respect jurisdictional boundaries. And I think there is now a growing concern that different systems that could change as different people come into power or are elected over time are going to create confusion for people and end up creating some places where it is more likely you will have more individuals who are unvaccinated. We're spending time on vaccinations, and this is why for people with disabilities, there are lots of people who are too young or are medically frail or immunocompromised who maybe can't be vaccinated. And so those folks, and a lot of them are people with disabilities, rely on everybody else not getting sick to have a better chance of not getting sick themselves. Vaccines do mean that people tend not to get a disease or will have a much less serious illness if they do give it a disease. And they really do reduce the chance that preventable diseases spread, because the more people are vaccinated, the fewer options there are for diseases to kind of go and infect individuals. So if the number of people who are unvaccinated goes down, whatever the reason is, whether it's confusion or different requirements in different states, or there's lack of access to vaccines because you have people who want a vaccine but can't get it because they can't afford it, or there are fewer vaccines being made. Whatever the reason is, when the overall population of people who are vaccinated goes down, the potential exposure to diseases goes up for people who aren't vaccinated. So that's kind of the policy reason why this is a focus for people with disabilities, is that we have many more people who are in that category of really there's a medical reason that they can't be vaccinated, and they rely on most of the rest of the population being vaccinated to lessen their chance of getting a disease. Other activities this week that have happened, you might remember that the HR1 cut an enormous amount from the SNAP benefits, and we've talked about the various changes that have happened that we believe will infect that program. This week, the Bureau of Labor Statistics announced that it will no longer do its annual report on food insecurity. And that report has been a really important way for policymakers to understand not only how much food assistance is needed, but the impact of that food assistance on people who are food insecure. So now that this report is no longer happening, it's one less measure, one less, kind of overall look at hunger in America. And there are a lot of advocates that are very, very concerned that we are going to potentially have many more people who are in need of food assistance or who are trying to get food assistance because their money isn't stretching enough to afford everything they need, and it's not going to be measurable anywhere. The amount of folks who are at risk of being hungry or who are hungry at the very time that states are going to have to make tough decisions about, how do they continue to fund their the food assistance programs that they're running, which are now 100% funded by the federal government, and that will change as of January 2026, where states are going to have to absorb much more administrative costs than they currently do, which will create a hole in their budget, as well as implement some very different prove you're working or exempt requirements, and have a lot more people who are included in those requirements than are now. This week also, there were some reports of a dramatic decline in the number of staff that are looking at fair housing discrimination laws. And again, those are laws that are important to people with disabilities because there are certainly people with disabilities who find it very difficult to find a place to live, that especially if they have accommodation needs. So a lot of the fair housing cases that have been historically pursued have been about, people who are having trouble finding somebody who will rent to them, and that sometimes those folks who are refusing to rent are doing so because of a discriminatory basis. 65% of the Fair Housing Office staff is now gone. And effectively, that means that the existing law on the books, the Fair Housing Act, is not being enforced. We have seen a similar pattern where the Office of Civil Rights in the Department of Education has had significant staff cuts, which has really limited the law hasn't changed, but whether you can get a case that enforces IDEA rights, for example, is much reduced. That's also true of the Office of Civil Rights in the Department of Justice. So this is another area where there's been an effort to reduce the amount of people with expertise who are enforcing laws that do have a disproportionate impact on people with disabilities. A new report is coming out in October, and I expect that we will cover it in depth more when it comes out. There was a UW Wisconsin researcher who's affiliated with the report. We have been covering over the last few months changes in policy that the Social Security Administration has been implementing. And lots of advocates have been warning since the spring that some of those changes will disproportionately impact people with disabilities, especially if they don't have good access to technology or they're non-drivers and they have to, now have to go to a field office, whereas they could do something on the phone before. So this report is coming out, but the initial coverage of it is saying that yes, people are having a much harder time. If you're one of them, you can raise your hand on that, and that people with bad internet access or who have complicated questions that really do require expertise are the folks that are having the much harder time getting what they need from Social Security. And as a reminder, there are lots of people with disabilities that are in SSI benefits. So this is a pretty big group of people where if we've made the process harder, they are much less likely to be able to navigate it successfully. We are continuing to see fallout from the HR1 cuts to Medicaid before those cuts even happen. In the last couple of weeks, we have been covering some activities in different states where states are cutting their Medicaid provider rates in advance. North Carolina and Idaho are among them. And there are several other states that are considering reducing rates to providers in Michigan and Pennsylvania. Those states have not yet passed their budget this year, but they are considering Medicaid cuts as they work on their state budgets now. In Washington State, yet another example, this is an example of one of the things that we said could happen as states look at what are the ways to fill budget holes. The lawmakers didn't change who was eligible to get into Medicaid, but they made very large cuts to the program that are going to impact services. So their state budget made a $782 million cut to Medicaid. Basically, they cut $336.5 million in the state matching funds. And if you put in less state match, that means you're not able to draw down the matching amount from the federal government. So any amount of cutting to Medicaid from state funds really has a bigger impact, because when you cut the amount of state match, you are also cutting a much larger amount of federal dollars that won't be coming in. So that $336 million cut of state funding actually translates into $782 million because you aren't able to draw down that extra $446 million in federal money. 95% of the reductions that are part of those cuts that were made are to general medical care, services for people with disabilities and seniors, and long-term care assistance. So again, everybody who was eligible yesterday is still eligible today, but what you can get has changed. When you cut money out of the system, you do reduce the number of providers who are providing that assistance. And that means that if you have the same amount of people or more who need those things and fewer people to provide them, some of those people are eligible, but functionally unable to get the services that they need. And this article was very clear about saying that. One last article. The Government Accountability Office, which is a federal office, has been examining the existing Medicaid work requirement program. There's only one in the country that's up and running right now, and it's in Georgia. So they have been kind of rolling along for a period of years now, and the GAO report shows that a good portion of their spending is on the administration of the program, trying to figure out whether people have been working enough or to participate, much more so than the amount that they're spending on actual health care. Now that administrative amount has declined a little bit over time, but it's still at, the most recent number is that they're spending almost 60% of the money in this program on administrative costs and not on care. And the number of people who would be eligible for the program is about 250,000, and only under 10,000 are in the program. So there have been a number of things written about this particular program, but as we are looking at all states having to do a version of work requirements, it's particularly interesting to see how many people are not able to get through and navigate to get into the program and stay into the program, and also how much it costs states to kind of have that extra layer of administration to scrutinize the people who are trying to use this program to access health care. And with that, I'm going to stop.
I think one of the questions, and I just want to make sure because, I don't want people to be fearful, was kind of about the shutdown and whether Medicaid would not be funded and would people start to lose their services. And I said, our state runs our Medicaid program. They get reimbursement from the federal government. So, I don't see that there would be any changes to the services people are receiving during the shutdown. And you had mentioned it wasn't on your list either. So I just wanted to.
In the past, and I don't want people to get too worried. It's just whenever I see something that is normally listed that's not, it piques my interest. Under government shutdowns in the past, every single government shutdown, Medicaid has been listed as one of the mandatory programs that is not impacted by a shutdown. It happens that this particular list did not include the word Medicaid on it. That's all we know. So in past shutdowns, Medicaid and Social Security and Medicare everything has operated as normal. There's been no adjustment. You are correct. The state, it's state and federal dollars combined that pay for Medicaid. And Medicaid is a reimbursement program. So it is paying for healthcare worker time that has already occurred. It's a reimbursement basis. And generally what states are doing is they are asking the federal government for the federal government's share of those costs. So they are submitting up, here are all the reimbursement claims from healthcare from providers who have already done the work for Medicaid folks, and those claims are approved, and the state is getting back the federal dollars that match. That's typically how it works, and it has always, in previous shutdowns, that has been uninterrupted. This spring, there was some concern about interruption of Medicaid payment portals for a couple of days that caused concern. All we know is that, this particular publication didn't include Medicaid on that list of things that would be uninterrupted. That could be an omission. It's who knows. But always before, Medicaid has been uninterrupted and what is happening is the state is basically saying to CMS, here are our bills, and could you give us the money that you owe us to cover the cost of those bills? And that is the cycle that continues, at least in past government shutdowns.
I think that was it then. I think we're good. I'm going to hop off. Goodbye.
Okay, we will get these slides out to you and the recording out to you this afternoon. I hope everybody has a restful weekend, and we will be back next week because I think it will be another rich, full set of days with lots of activity.